Aloha, this is Dr. David Bilstrom from the International Autoimmune Institute and the Autoimmune Lifestyle, and this is Did You Know? Now, we're going to talk about treatment and prevention and diagnosis of the autoimmune disease that drives autism spectrum disorder, the folate receptor alpha antibody autoimmune disease, but also the cerebral folate deficiency, brainy neurologic system stuff. Now, when it comes to prevention, that's the best kind of treatment, right? Now remember the mantra, papaya, prenatal, before conception, antenatal during pregnancy, pediatric and young children, adolescent, and then young adults. We want to fix things so you flip off all the bad genes, flip on all the good genes in every cell in your body to prevent disease. Now, if you do that in the mother and father before conception, remember, well, actually, you may not remember, it's in the course, the autoimmune paradigm. We talk about if a parent, such as a mother, has an autoimmune disease, the children are so much more likely to get every autoimmune disease, not just the one the parent has, because it's not one, it's just one disease that can attack any body part. It's not like hundreds of different kinds of autoimmune disease, right? So if you're preventing one, you're preventing all. So if we want to prevent autism, we want to prevent the autoimmune autism, this folate receptor alpha antibody autoimmune disease, we want to do it before conception, okay? Now, the testing, you want to test for homocysteine, okay, just like we always do. We want to test for folate, right? We want to test for the antibodies, the folate receptor alpha antibodies, IgG, IgM, ideally in mother and father before conception, so we have a year or two to turn it off, get rid of their autoimmune disease, help prevent all the stuff in the kids. During pregnancy, yes, of course, we want to test the mother, right? And you say, well, why test the father? He's out of the picture now, right? He's done his kind of stuff. But no, we want to test the father as well because we want to know what the child's future looks like if we don't fix it, okay? So what about if the mom's negative? We go, oh, we don't need to worry about it. But if the dad's positive, we go, right? The stuff we talked about last video with this profound autism and all this kind of stuff, right? So you want to test the dad too. Now, you also want to test, then once the child's born, you want to test the child and the parents, right? So we know where the kid's going, or if they're already starting to show signs of autism, we want to know why, and we want to have these lovely markers to know what we got to do to fix it. We also want to have these markers to know when we've totally turned around the autoimmune disease, not just their symptoms are gone, their autism's gone, let's say, or remarkably better. We want to know we got the autoimmune disease stopped so that we have now protected them from any autoimmune disease and ideally other diseases as their life goes on. Once again, aloha from the Big Island. Thank you so much.